Do you know why most people lose their lives on reaching the health facilities or shortly before a care or procedure is being given? Alright, let's dive more into this. I'm your health promoter and advocate, Letitia. Follow me at ProHealthRN on all social media handles. Alright, let's get going. The first reason why most people tend to lose their lives before getting to the health facility is 1. Procrastination. If I talk about procrastination, this is where you tend to push a care or a particular thing to the next day, and it follows like that. Okay, so when you procrastinate from day to days to weeks and to even months, this puts you at risk. Let's say you have a headache or you have a particular pain at any part of your body, and you tend to ignore and then start to procrastinate when to go for care. Sometimes we do schedule ourselves, I'll go next week, I'll go next 2 weeks. When the particular time gets there, you tend to procrastinate again and push it to another day. So in as much as we push the days forward, we are indirectly pushing ourselves to the danger zone. Alright? When we keep pushing ourselves to that extreme, we are pushing ourselves to the danger zone. So the danger zone is where complications set in. And where complications set in, complications means it becomes so broad. So if, let's say, your condition is just like a tip, a fingertip, you realize that now you have like a whole finger, then now a whole arm, then it gets over. So procrastination is a thief of time. But here, it's not just a thief of time, it's a thief of life. Make sure that when you are unwell, you feel unwell, you do not procrastinate. Please and please again, do not procrastinate your care. If you feel unwell for quite some time, you feel unusual, that's unusual about you, you can feel that this is not who you are, this is not how you behave, make sure that you seek for the right assistance as early as possible. The next thing I would love to talk about is defaulting, means stopping your medication. Alright? Some people do not just stop their medication, they even reduce their doses. Some individuals decide to take it as to when it's necessary to them or they feel it's okay for them to take. And this is too dangerous. Stopping your medication or treatment being given on a particular condition or for a reason is too risky. Please do not stop taking your medication. I don't know whatever condition you might be going through. Please do not stop taking your medication. As you watch this video, if you know you've forgotten your medication, you skip it. Just take what you are supposed to take at that day and continue like that. Alright, please do not skip your medication. Do not stop it for any reason. If you feel that you have a funny feeling or that's not how it's supposed to be, it's not working the way you want it, make sure that you visit your health practitioners, those that gave you the medication or whoever gave you the medication. Go back to them, explain it to them, and probably it might be changed for you, or maybe an advice or something will be done. So please do not stick to your own understanding and then just stop it. Do not stop it. Do not skip your doses. Do not take it the way you like. You know, when you do things the way you like, you are telling your system that let me treat you anyhow. You are telling your system that I can't conform with you. So your system behaves like that. And when it gets to the extreme, it can expose you to death. So please, let's stick to our medication. I hope I'm not scaring you. Let's make sure that we stick to our treatment regimen as it's supposed to be. The next thing I'd like to talk about is seeking advice from the right people. Sometimes when we are unwell, we tend to call families and friends. I'm not well, I think sometimes you have people, someone will tell you, oh, I think these are symptoms of malaria. You are feeling cold. Oh, are you sure? You are vomiting. Okay, if you are vomiting, then this could be malaria. Sometimes it could be true, yes, but sometimes it's not what it is. You might get to the hospital, and in this setting, especially in Ghana here, where people mostly like to buy any medication at all. Please, let's resist from doing that. And sometimes going the extreme is too dangerous. Okay, so let's make sure that we visit our health practitioners. We hear from them. Let's tell them our symptoms. Let's tell them our problems. Let's tell them when it started. Let me make this important point. You know that most of the times when individuals visit their health practitioners, they don't give the right history or when it started. Someone might be having hypertension for the past 10 years and will tell you, oh, I started feeling this symptom just last week. It was just last year. Sometimes when those lies are being said, you are not just deceiving your health practitioner, but you are deceiving yourself. Because if you tell someone you just started having a headache, meanwhile the headache has been there for several months, the person will not conduct a further investigation to see why that headache. But when you tell the person it's just yesterday, the person might feel stressed or probably due to something and will give you an immediate treatment. But when the person realizes that it's been there for several years, perhaps you were not treating it or you were treating it with a particular medication, they will take all those histories and they will all come together to give you that holistic or the total care that you needed. But when we visit and we try to forge our own stories, and I think it doesn't help. Let's be truthful when giving our history. The last but not the least is self-assessment. Whenever we are taking our medications or our treatment or undergoing a procedure to achieve a particular goal, we should make sure that we also examine ourselves, reassess ourselves. Is it working as it's supposed to be? If it's not, you make sure you talk to your healthcare provider. Let them know that it's not working for you. Do not just accept anything at all. Nowadays that people could do anything at all to just make money. We should make sure that we talk to them. When you speak to them and you realize it's not getting anywhere, go on to another person or another care, another health care center to seek for the necessary attention you needed. I hope this goes a long way to help all of us. Make sure that you be consistent with your medication, that's taking it at the right time, adhering to your lifestyle modification. If you've been taught to change a particular lifestyle like alcohol, cutting down on fatty food, stopping of smoking, whatever lifestyle changes that has been advised or prescribed for you, make sure you follow it. Exercising maybe twice a day, 30 minutes, make sure that you do all that and seek for the right advice from the right people at the right time. Thank you, and I hope you are not going to procrastinate your care as well. Thank you for watching. This is Letitia once again, Pro Health Nurse on all social media handles. Thank you for following. See you again.